Now, as we've been hearing, more than 10 million people have now received their first dose of a coronavirus vaccine, with an army of volunteers giving up their time to help with this massive effort. We spent the day at a vaccine centre in Southall in West London with a GP, Dr. Kamini Gautam, who takes up the story.
This is the Dominion Centre. This is where patients come to get vaccinated in Southall. This is the main hall. Patients will enter through the door that says no exit over the top of it because it's a one-way flow. They will be directed by our lovely stewards.
Number 8, if you can just go to press the 8. There we go.
We've vaccinated over 11,000 people here within the last 3 weeks, and we rely very heavily on volunteer staff members.
Can I have the sign-in, please?
We have reception team members who have been deployed from their regular practices. And the same with our clinical staff through the house.
I normally work as a nurse in a respiratory high dependency unit. I'm actually on annual leave at the moment, so I'm doing this kind of just on the side so that I can help out really.
Having dad over 85 and mum over 70, the lockdown has been not very easy. It didn't take us long, straight on the wheelchair and straight in, and it's been very good.
Okay. This is where all the vaccine is kept. Both the vaccines have got very different sort of profiles. The Pfizer one is a little bit more fragile, as it were. So we try and make sure that we use up all our Pfizer one before we actually go on to our AstraZeneca. We have had a few people who've expressed concerns about having the vaccine. Of course, we do like to reassure them that both these vaccines have been widely trialled, and certainly from my 3 weeks of working here, I've not seen any major side effects.
When they came to my office to give some stuff, I refused. But after reading the side effects and everything, and then what it would do in future, I just opted to take it. And I'm glad I made the decision to do it.
Seeing people get vaccinated, it gives you the sense that, look, there is light at the end of the tunnel, which is not another train.
One of the things that really struck home was how isolated so many people had felt. People are frightened, people are scared, people are worried about their loved ones, so people aren't visiting. But the gratitude in people's eyes made this really, really rewarding as an effort.
Dr. Kamini Gautam there ending that report.